Hi there, thanks for having me. My name is Dr. Nora. I'm a cosmetic doctor, general practitioner and clinical lead for Treatment Pad. And I'm here today to talk to you about how I've improved my own patient satisfaction in my clinic. When I first started out as a cosmetic doctor, I probably wasn't the world's best post-treatment salesman. I would take my pictures before and after naturally, but after the procedure had been done, I'd present my patient with a mirror and their before picture on one application, and I'd ask them to have a look at the differences between the photographs. So there we go. Now, if you put yourself in the patient's shoes, they may have just enjoyed, say, a 20-minute of an uncomfortable procedure, for example, as a lip filler. They might already be feeling a bit weary, a bit dozy, and you ask them to have a look at the changes. They might not be 100% on board with what you're saying. And so you're having to spend more effort and more salesmanship to tell them this is the difference or this is what's changed. And that may have a knock-on effect on the patient, and they may feel a little bit confused going out of your consultation. And in the worst case scenario, you would have to spend quite a few minutes going through this, and this is time that simply you just don't have in your clinic. For you. So swelling will go up tomorrow and then it will reduce down the next kind of 3 or 4 days or so. Don't rub or touch the areas. Don't sort of put any lipstick or any makeup or anything like that over the lips. Yep. And so when that patient leaves your clinic and they're not really 100% on board with what you're saying and they don't quite understand what's happened, they'll then have a conversation with their friends, their family, and they then will ask them as well, you know, what's changed? What looks different? Was that there before? Are you sure you had this done? And so that patient will become even more confused and even more a little bit untrustworthy of what you've done. And so now when that patient goes away for their 2 weeks and they come back after their 2 week for follow-up, you might have prepared your before and after pictures ready for presenting to the patient, but rather than being able to present them that beautifully edited picture, they then have like 100 questions for you about what the procedure was like and what's changed and why does it look so different. And so now rather instead of focusing on the before and after picture to show your patient and showcase the lovely photos that you have done, you're now having to ally all of their fears and their concerns. And again, this is time that simply a lot of us just don't have in clinic. Now, if you're anything like me, I get paid for my treatments, and so having consultations with patients for follow-ups and for answering questions is not necessarily the most monetary effective scenario for me to have. So unfortunately, I would like to reduce that amount of worry and concerns I have for my patients as quickly as I can. And so I thought to myself, well, there's got to be a way that I can show my patient their before and their after picture during their clinic beautifully edited. And I did find a number of applications online and on my phone and my iPad, and I would use them, and I would say I did use them to a degree. And yes, it did give me the ability to show my patient before and after pictures, but the concern is that the pictures were so fiddly to edit. A lot of the applications out there, for example, layouts and so on, you have to really zoom in quite a lot and you have to do a lot of cropping and a lot of zooming into the patient's face just to try and find out what the correct picture should be and the correct angle as well. And so all the while, whilst I'm playing on my iOS device, but be my work iPad, for example, I'm looking down like this and my patient's sort of looking at me thinking, you know, is everything okay? Is there a problem? Why is the doctor taking so long? What's wrong? Is there something wrong with me? And so then that starts to build that confusion again, that worry for that patient. They start to think, oh my goodness, what's happened during my treatment? Is everything okay? And whilst it may only be a simple matter of a couple of minutes of you trying to edit a picture so you can save it to show to the patient, for that patient, that antagonizing wait is just enough to make them feel that something is not quite right. And so not only does it make the patient a little less confident in your own abilities, and even though you might be the best cosmetic practitioner out there, it also has an impact on your day-to-day life as well. So you might have to spend more time editing your photos. You might take those photographs home. And certainly I have a number of colleagues who have told me that they take their photographs home, they spend an hour at the end of each clinic day, and they will edit those photos just to present to their patient. Now, Jake, one of the biggest things that I have in my clinic, the issue is trying to get before and after pictures being accurate. What do you currently use at the moment to try and get that accuracy?
I agree, it's a real struggle. So right now I'm using a combination of apps, all done by myself.
And that is time that you could simply be using for another activity. You could even be doing jet skiing or sailing, for example, rather than editing photography. And so I thought to myself, well, there's got to be an even better way of generating before and after pictures at a click of a button, and hence the birth of Treatment Pad. So now I use Treatment Pad in my clinic, which allows me to, after I've seen my patient for their consultation, we've gone through the procedure, we've gone through the risks, we've signed the consent form, I ask them to stand up at my designated wall. I take some pictures, tap, tap, tap. Hey. Okay, so first up, Mary, we're going to take some pictures, okay, and then we will do some after pictures afterwards, and we'll see how you go.
Okay,
perfect.
Thanks.
So right now I'm using an application called Treatment Pad, which I use on my dedicated work iPad. And the great thing about Treatment Pad is it allows me to have a split screen whereby I can see my patient's before picture on the left hand side, and it's even got a live camera on the right hand side. And Mary, I'm just going to ask you to give me a few funny faces. So give me a smile. Beautiful, thank you so much. Now we're going to use this application right at the end to do our before and after pictures, and with an instant touch of a button we'll be able to show Mary our lovely pictures after the procedure. All right, Mary, let's get you on the couch and get injecting. And then we'll do the procedure, and then once the procedure is done, I can then take my after pictures with a real-time picture on the right-hand side of the screen and the before picture on the left of the screen, and I'm actually able to tell the angle of the photos that I'm also taking as well, helping to keep that accuracy. And then with a tap of a button, my pictures are automatically aligned thanks to the facial markers that is used inside of the application. The images are nice and cropped in. And we'll talk a bit more about the technical details in a moment. And the best thing about it, I'll just demonstrate it to you, is you can select your patient's before picture on the left side and the after picture on the right-hand side, like so. When we find it, there we go. And automatically it uses computer algorithms, machine learning to detect where the facial markers are, like so. Zooms into the picture, crops it in, and then with a touch of a button you can save it, just like that. And then we can do the same for the other faces as well. So the smiley face automatically aligns in with the patient's face, which is gorgeous. And there we have it, save. And again, with a touch of a button, we can just get the kissy face versus the kissy face that we did just now. Aligns it in, save it. And then what you can do next, if you want to, is edit your image. You can even pop in your own template like I have done here. You can add a blur and you can add some text as well. So pretty cool and easy app to use. And now it's time to show my patient. But what the biggest impact is on the patient is that no longer are they having to look in a mirror and decipher what's going on. No longer are they having to go home and speak to their friends and being all confused and not really too sure what has happened to their procedure. Instead, in the clinic, they're able to see their real-time before and after picture instantly and accurately, and you're able to point out the differences to the patient. This is your before and this is after. Yeah. So what we've tried to achieve is obviously a bit more widening of the lips. Right. We tried to roll up that top lip, which I think we've done quite nicely there. Definitely. Yeah. And the inflammation obviously will settle down. It's going to get a lot more swollen tomorrow, and then after 3 or 5 days it's going to completely reduce. But this Cupid's bow
looks good.
Yep, looks
Absolutely,
nice.
Yes.
And it's flicked through to the other side. It's your gorgeous smile. Much bigger lip, isn't it? Yeah, it's nice. It's really nice. Yep. And then we've got the kissy face.
Yes. They are big. Yes,
they are big. They're going to get smaller. And the net impact of that is that patient is able to reach what I like to call a peak level of understanding during that clinical consultation. They're able to get on board with what you've done. They're able to see what your treatment is, and then they go away and they feel very empowered. And now that they've got that picture, and they may even ask you for a copy of it as well, they can then present it to their friends, and they know exactly what to tell their friends. They know exactly what the changes are. Beautiful. Have a seat for me. Okay. But there's definite more definition for sure, and you can see there's more of a line here. Despite the redness, you can see there's definitely a line coming through. And you can even see, actually, what's interesting is your chin underneath. It's kind of pulled back a little bit, so you're getting less of the sort of the saggy area. Well, not saggy, but less of the pull at the chin there, which is nice. These ones look fantastic. I think this is where you can really see where the difference is. So you can see here much more defined. Okay, so let's take a look. Before and after.
Oh wow.
It's a huge difference, isn't it?
It is.
Yeah, so you can even see as well, there is redness, it's hard to see past the redness, but there are fine lines. We call them smoker's lines or barcodes lines, but which tend to happen. I know you don't smoke, that's why we call them barcodes lines as well. But these happen because we're always using that muscle. So we start to develop these lines, but with lip filler, you can actually eliminate those lines because it just opens it out and spreads over the area. So for you, it has actually reduced them, which is great. And it's giving you this nice, I think a lower lip, I think both of it looks good, but your lower lip has really popped out. It's giving you some nice definition as well. Really hydrated your lips. It makes you look more youthful too as well. Wow. Yeah, so different. And we're going to go through our pictures. So smiley face with a closed mouth. Oh, they look so beautiful. And a smiley face with a big mouth. Yes. So with this application, I can actually literally instantly, take Maria's before and after pictures and show her straight away how she did. So this is the before picture. And if I scroll to the after picture, I can, with a tap of a button, align the pictures up. And then save that. I know, I can't wait. I'm going to show you them all. I'm going to get them all ready. So let's take a look. So this is your before, this is your after. What you can actually see as well, if you notice, obviously your lips are fantastic, they look gorgeous, but look at the upper lip. Yes. We've really kind of evened out those. So we fed a couple of mils just through this area here as well, just to try and smooth it out. And it will get better as the 2 weeks progresses as well. But the lips look gorgeous, they look so good. Look at that smile. And you've got a gorgeous pout as well. Your pout is just phenomenal. It's Maria, you look stunning.
Thank you
so
so
pleased
much.
for you. And they, rather than them coming back 2 weeks later for a consultation where you might be dealing with a complaint, for example, they may come back and say, you know what, I love this, can you do this now? Or my friend really loved this, can you do them now? And they become your brand ambassadors. And as all of you know out there, having a brand is super important, and having people to have confidence in your brand is also really important as well. Which leads me on to my next topic, which is social media. Now, for those of you out there who aren't on social media, I would strongly urge you to get on there, because a lot of patients use social media nowadays to find their next cosmetic practitioner. And it is very easy for patients just to scroll through Instagram, say, and find somebody on Instagram and have a look at their work. But what's interesting about social media is that when patients see your work, they become familiar with it. And so then they actually start to become more trusting and more confident in your ability. And so then what happens is when that patient then scouts you out and they quite like your work, they'll come to clinic and see you with open arms. They'll be more receptive for your work, and they'll feel like, yes, I can trust this person. I've seen their work online. They look really good. I love their before and after pictures. And so now, instead of having that patient coming into you defensive, they may come in a lot more happier, which leads to a much more positive outcome. And for me personally, I have had that happen to me a lot in clinic. I've had patients coming up to me and they often treat me like a celebrity, even though I'm definitely not a celebrity. But because they've seen my work online, they've become familiar with my branding, my work, my before and after pictures. They fall in love with the photography, and so they come to me for their cosmetic procedures, which leads to a very highly desirable outcome. But not only do you want to try and receive those prospective clients into your clinic, you also want to produce photographs that are of a high quality. It's so easy for a patient to scroll past the picture, a before and after picture, where one is slightly small and the other one is zoomed in, and it just looks a bit wonky, it looks distorted, it doesn't look right. It's very easy for them just to scroll past, and then you've lost a potential customer. So if you're able to have a picture that is of a good quality, it's nice and accurate, it's zoomed in effectively, you'll be able to capture their interest, and they may click onto your page and they may have a look at your other work as well. Now, speaking of wonky pictures, we are all bound by APRA's guidance for marketing our before and after cosmetic procedures. And those pictures should be similar in terms of their lighting, their background, and their camera angle, just to name a few examples. Which makes sense because if we take a photograph, for example, of the lips too high, the upper lip looks larger than the lower lip. And conversely, if we take it too low, the lower lip looks bigger than the upper lip. And so that actually distorts the photograph, and it causes a little bit of mistrust in your patients and those prospective clients. It is because I can see what she looked like before, I can tell what the angle is, and that's really important because if I put the camera too high, the bottom lip looks bigger, and if I conversely put it too low, the top lip looks bigger as well. So it's really important to get it centered, and the application does have an internal logistics that actually tells me the analysis of the camera angle as well. So here we can see it's 0. So where does Treatment Pad come into all of this? Well, Treatment Pad is a digital application that's available on iOS devices. It is free to use, and it does have some upgradable paid subscriptions. Once you open up the application, you'll be met with your patient's gallery view of their photographs. Now, something that I like to do in my clinic is to create new albums for my patients. So this helps me to keep myself organized so that when they do come back for their review pictures, I'm easily able to find them. And so this lady has come in for her review of her anti-wrinkle treatment to her forehead. And as you can appreciate, the before picture is slightly more zoomed in than the after picture, and the picture is just not the same. And so what I can do is with the tap of a button, I can press on the pictures and automatically the eyes, the nose and the mouth are aligned, and it's zoomed and cropped in appropriately. And so it makes it a lot easier for the patient to see. Now, with regards to fine tuning, you can also fine tune these photos as well. It does have a grid application, which helps you to have a look exactly to see whether or not it is in the right orientation. And there's also a link view. You can press over here and you can zoom in specifically to an area to point that out to the patient. For example, I might want to point out that her forehead is much improved. In addition to that, I may also want to change the orientation of the picture, which I do with this button over here. And so again, with the link view, I can move the pictures together. Now, not only am I able to have a look at the patient's pictures before and after, but I'm also able to categorize the photographs, for example, in different orientations. If, for example, I want to have a look at the portrait only, or the facing left, or the right, and so on, I can show that to that patient. And so now when it comes to taking your photographs, you can open up the camera view and you'll get a real time of your patient. Now, obviously this is me, not my patient, but you can automatically see what the camera angle is on the bottom of the screen, and it will guide you as to how you take your photographs to maintain that accurate camera. Now, once that has been done and you're happy, You can then also add in some brand editing into your photographs by pressing on this button over here to add in your pre-made template. With all of the features that TreatmentPad has to offer, I can say that I have had a huge amount of value from the application. No longer am I having to do that post-treatment salesmanship with a mirror in one hand, the before picture in the other. And no longer am I having to edit those pictures in the evening. Instead, with a tap of a button, my editing is already done for me. I can, with a tap of a button, align the pictures up and then save that. I know, I can't wait. I'm going to show you them all. I'm going to get them all ready. And needless to say, my patient satisfaction has dramatically increased. And then we've got the kissy face.
Yes, they are.
But how does this scale? Well, to date, globally, we have over 80 paying subscriptions. But what's more interesting than that is the retention rate of those clinics. Now, usually when you have a month-to-month subscription, some people may drop out after the first or second month because they don't find it useful. However, with TreatmentPad, we have over 80% retention rate, which for me shows me that there certainly is people out there who are also valuing from this application. I do hope that you found this talk useful, and I hope that you will also gain value from this, and I look forward to any questions in the Q&A later on. Yeah, that's it. So we fed a couple of mils just through this area here as well, just to try and smooth it out, and it will get better as the 2 weeks progresses as well. But the lips look gorgeous. They look so good. Look at that smile. That's $1 million smile, isn't it?
Isn't it amazing difference?